We have some exciting news, and I want to introduce myself. I'm Mandy Bolter, Chair of the Kent County Board of Commissioners. I'm here on behalf of the board to announce, along with Mayor Rosalind Bliss and our Director of our Health Department, a new initiative called the Lead Action Team. And we all know that lead's been a problem in our community, and we've all been working very hard to try to solve it. But I think in 2014, when we all found out that there were more lead-poisoned children in the 49507 area code than in Flint, it kind of was a wake-up call for our community. And so I know that we've all been working on this. I want to acknowledge Commissioner Breevy. She started the Kent County Lead Task Force a couple of years ago. We were focused on what we were doing in Kent County on this issue. The city started Lead Free Kids in the city of Grand Rapids. And then, of course, Paul Hahn has been working at Healthy Homes for a long time to do this work. And all of that's great work, and we've all been working very hard, and we all care about the children in our community. But I kind of got a wake-up call probably beginning of last year. We were at a board meeting, and we had several moms come to the board meeting who were still just upset, tears in their eyes, because their children are still being poisoned by lead in our community. And so, all this work's happening, we're doing all this stuff, and I kind of just decided maybe if we all collaborate and we pull our resources together and we kind of come together as a team, maybe we can be more effective. And the word action is in the title for a reason. We want to take action, but I don't think this is going to be a short process. I think this is going to be a long haul, and we're all committed, right? So I want to talk about, this isn't just a City of Grand Rapids initiative, this is also a Kent County initiative. I think one of the concerns we have in our community is kids on Medicaid are being screened, but possibly private insurance children are not being screened. And if you live in a home that's older than 1978, chances are you have children who potentially are at risk for being poisoned by lead. So we need an aggressive education process in the county, and we're going to continue to work with our partners. So with that, I'll bring up the mayor, and she's going to talk about a little bit more about it.
Great, thanks. Thank you. Good afternoon, everyone. Today is a beautiful day here in the city of Grand Rapids and in our county, and I'm absolutely delighted to be joining my colleague at the county, Chairwoman Mandy Bolter, as we kick off this really important initiative today. And I want to acknowledge some of my colleagues here who have been working hard at the city for a long time on this issue and who were partners with me on our Lead Free Kids committee, and that is Commissioner Lanier and Commissioner Park. Commissioner Lanier actually served on the county team. And then my history dates back to even when I was a commissioner and I had the privilege to serve on, actually I've served on 2 statewide committees looking at the issue of lead and how do we prevent children from being poisoned. I did that with one of our great champions and leaders in our city, Mr. Paul Hahn. He also continues to be active not just at the local level, but also at the state level. And then I see a lot of folks who are in this room who are part of both the county team and or the city team, and I know I have city staff here as well, and I appreciate their hard work in everything they've done in the past, but also the work that we're rolling up our sleeves and getting ready to do today. So the Lead Action Team, I think, is a really important next step in our community and our response to this critical issue. And it's really aligned with the recommendations that were shared this morning at the City Commission. And one of those recommendations was that we have to coordinate and collaborate a whole lot more effectively if we're going to tackle this issue. It's not just an issue that lives in the city, even though we see a lot of children in the city poisoned by lead. This is a county-wide issue, and it really needs a multi-jurisdictional response. We need to be working together at the city, at the county, and at the state level. And our health department, they are the health department for our entire county, but they are the ones that are most equipped and skilled to lead this initiative that looks at public health. And that's why I'm so delighted that the county is taking the lead, but also that our director of our health department, Adam London, is going to be in the driving seat of this initiative. While we have seen the rate of elevated blood levels decreased dramatically over the past several decades. That's something we should all be proud of. We know that there's still a lot of work to be done. There's a reason, as Chairwoman Bolter said, that action is in this title of this team, and that is because we have done a lot of work studying this issue. We have a lot of recommendations that I've put in place, and now we need to really focus on implementation. As long as this public health threat persists, we will continue to respond. We know that lead poisoning has and can have a dramatic impact on the lives of children, but also on our entire community. We know that it impacts the developing brains of young children throughout our community, and that it can have long-term neurological impacts. And as I've said, we've worked hard on this issue for a long time. We've seen those numbers decrease, but even one child poisoned in our community is one child too many. So I want to talk about a little bit, just briefly, and then I'll turn this over to Adam. I want to give you a sense of the work that we've done over the years with our partners, really, and I want to give another kudos to Paul Hahn and his work in our community. We have worked really hard on this issue for a long time. We've invested millions of dollars in our community. Since 2004, we have helped to make over 1,700 housing units lead safe. We have provided lead awareness and education to over 1,800 residents and property owners and contractors, and we have helped train more than 150 individuals as lead abatement professionals. But we know that that is still not enough. It's moving us in the right direction, but it's really only a fraction of the work that we have to do. Lead poisoning is complex. It is a complex public health issue that, as I said, really requires all of us to come together, both from the public sector and the private sector, to make sure that moving forward we can truly, truly eradicate lead poisoning in our community. I believe that this problem is significant, it's complex, but like many complex problems, I do fundamentally believe that it's solvable, and the people in this room are going to help make that happen. So thank you again to everyone who has worked so hard to get us to where we are today, my colleagues on the commission, but also thank you to all of you for stepping up again and taking the lead on this critical issue in our community. So now I will turn over to Adam London, our director of our health department. Thanks.
Thank you, Mayor Bliss.
Yeah, thank you.
Good afternoon, everyone, and thank you for coming to the Health Department, where we hold the value of making this a healthier community for all in the highest regard, and that's what we're all about. I want to thank Mayor Bliss and Chair Bolter for your leadership and your co-sponsorship of this action team, and your vision for what a healthier community for all can look like here in Kent County. We've learned an awful lot about lead poisoning here in Kent County over the past 4 years. Through the work of the Kent County Lead Task Force, through the work of the Lead Free Kids Grand Rapids Initiative, we've learned a lot of lessons. We now recognize that it's important that if we're really going to meet our goals, that we put these lessons into action by working together. And so we have created this lead action team. We have started with a steering committee, and I would ask the members of that steering committee, please raise your hand. There are many of them in this room. They are leaders from both the city and the county. There are leaders from nonprofit organizations from the state of Michigan, and there are parents on this committee as well. And that's very important to us as we move forward, that we have participation from the people who are most directly affected that have a voice in this process. We have 3 major goal areas that I want to briefly cover that we're going to be working on intentionally in this process. The first is clinical care. We believe that every 1 and 2-year-old in Kent County should be screened for lead. We believe that those kids who are at high risk should be tested for lead, and that those who have actual lead poisoning need to receive case management, and we need to work together to make sure that their lead problem is solved. We have another goal area in environmental health. Because this is essentially an environmental issue, and the most intimate of all our environments is our home. And we recognize that there are many of our neighbors who have homes that are unsafe because of lead. That's not acceptable to us. So we are going to be working together through inspection, through education, through coaching, through enforcement sometimes, through abatement and mitigation to make sure that we're addressing those lead problems in those unsafe homes. Then the third goal area we're going to be working on are social supports. Because we recognize that a family that has a child that has lead poisoning, that's an incredibly stressful thing for that family to endure. It's not fair that they do that without our help. So we're going to be looking at, first of all, learning what do they need to get through this crisis. And then how do we support them with temporary housing, with other essential needs to make sure that they have what they need to survive this crisis. I want to talk briefly about a couple of measures that we're going to be looking at as we move through this lead action team. The first is those who are in case management, because we believe there are too few that are in case management. Right now, about a third of all the kids who are diagnosed with high blood lead get into case management here at the health department. And that's unfortunate because of those who are in case management, most of them see their blood lead level reduced pretty quickly. Right now, 41 of the 65 families in case management have seen a blood level reduction below the action level, and the others are seeing sustained reductions in their blood lead. So it works. We need to do a better job working with our healthcare providers to make sure that those kids are coming to us for case management. The other measure I want to look at are homes that we know have a history of being a problem. So we have identified 427 homes in Kent County that have had multiple kids with elevated blood lead over the past number of years. Of those 427, we believe that we should be helping the homeowners, the residents, to identify where the threats exist in their home, and they can then deal with those problems. Right now, and it's only been a short period of time that we've been reaching out to these homeowners for inspection and for this sort of assistance, we have 82 that are at some process, some phase in the process of investigation and mitigation. On the left side of this pie chart, those colored slices represent those homes that are in some stage of intervention. On the right side, the large blue block are those that we are working to schedule inspection and counseling for those families. And we're going to track this. And we're going to see this get larger as we work with more of those 427 homes and as we get more homes addressed. One of the things that we've also increased has been our staffing in this program. And I want to thank the county commissioners who are here who have added 3 sanitarians to our team for doing those inspections of homes. We've also added an outreach worker. This is a position who can help navigate families to the resources that are available to them. And so the objectives of this lead action team fall within these 3 goal areas: clinical care, environmental health, and social supports. Our steering committee is currently working to recruit and populate each of these areas with a work group of subject matter experts who can make a difference in these areas. The objectives that you see here are a starting place. This is a living document. It's a living process. We plan to improve those measures, expand those objectives, add measures and timelines, and you'll see all of that on the county website as well. I also want to point out that here in the room, in reference to clinical care, we have Kathy Zacharias. Kathy, raise your hand, please. Kathy is a nurse here at the health department, and she has been involved with case management for some time. She's free to talk to people after this press conference about what it is we do in that program. We also have Brendan Earl. Brendan is a supervising sanitarian here at the health department, and he oversees the team of people who do those lead inspections, and he's more than happy to talk to you about what goes into that as well. And so finally, I want to say thank you again to all of you, and we look forward to working with this team and making a real difference. And I'd welcome Chair Bolter back to the podium, and she's going to tell us how we're going to remain transparent and how we're going to show progress to our community.
So are we all on board, ready to go? I think it's important that we're all, since we all are working together, we're not going to be able to measure success until we actually measure success. So we've got the website up at Kent County, accesskent.com, and our progress is going to be measured in the data stories. You see lead action report here, and as we scroll up, you'll see these are the various programs that have already been going on, and down here is our lead action team. We talk about the threat a little bit, we talk about community response, but this is a way for our community to check the website and get up-to-date data. You can see some of this from 2010 to 2018. The orange is Grand Rapids, the green is Kent County in general. You can see where we are making, it's a positive slope in the right direction. But when we increase awareness countywide, these numbers might tick up a little bit because we are going to have, hopefully, a lot more kids getting screened and a lot more kids getting support. So as you'll see, that we have other, getting us to the finish line. Adam talked about who's involved, but I think it's also important to note that this is an action team. So we're not just going to be in our government lane of what we can do at the county or what we can do at the city, but we're going to get creative and hopefully decide, hey, do we need to train more people that can lead abate homes? Maybe we need to grab a partner at a construction company or a place of education and try to do that. Whatever we feel needs to get done, we are all very committed to doing. So with that, I don't know if I want to call up Adam and Rosalind again for questions, if you guys have any. Any questions?
What's the initial cost of the partnership?
Adam can probably speak to that. I think there's time, a lot of time resource. I think a lot of people are already kind of doing the work. It's just pulling us all together and inventorying what's getting done and where are the holes. Right?
Yeah, that's exactly right. At this point, we have a number of people who are, for the most part, in the space already, but we know that working together we can get more done. We also know, and we have the support from our governing entities, that as we identify things that need to be done, then we're going to have a conversation about where can we invest to get the most return on that investment in community benefit.
And our hope too is once we figure out where these kind of holes in services are, maybe we need to contact our legislators or our partners in other areas of DC or Lansing to talk about increasing the Get the Lead Out program again or other resources that we may need. We still may need to identify some of those, so we're hoping that that is how that gets accomplished.
What are the demographics of kids who are affected and families?
So every demographic is affected by lead poisoning. There is a disparity for sure, especially in the urban area where kids of lower economic status, and there is a racial disparity that's involved. Now we're still working to better understand all those elements of disparity, and that's important for us to address. We also recognize there's a disparity in the screening though, because most all the kids in Medicaid are screened for blood lead, and many other kids on private insurance often aren't screened. So it might be a little premature for us to come to strong conclusions about that, but we do know that there are issues both in terms of socioeconomics and in who's being screened.
You know, I have a 14-year-old and 11-year-old, and they go to the pediatrician every single year, and we've never once been asked if we live in a home older than 1978 or if they would need to be screened. So I think that's important for countywide awareness. Yeah.
How does the Kent County Health Department and the City of Grand Rapids plan to share this initiative with our Hispanic community?
Rosalind, do you want to answer that? I mean, we're going to be totally transparent. The goal is to have everything up on the website in open meetings, I would assume, so we would be very transparent. But
Yes, and at the city, we share everything in both English and Spanish. We have a lot of you're one of them, great partners in our Hispanic community that help us provide education and awareness.
Can you talk about inspections? You said that one of the goals is to increase inspections at properties that have already been identified with children with high blood lead levels. What's standing in the way of increasing inspections or, for example, requiring lead inspections for rental certifications in the city?
Mm-hmm. Well, I'll let you speak to the investigation piece. On the city side, the report that just came out, we've been working on this for about a year and a half. One of the recommendations is to take a look at our current rental inspection program and add lead testing to it. All of that information and the recommendations now go to our city manager because there's a significant price tag connected to that. So as we go into the budget, we'll be looking at that. We are talking about and exploring potentially doing a pilot and really targeting and focusing on one area of the city to do lead testing more proactively. Our conversations in our lead-free kids task force, we're concerned about kids living in both rental properties and owner-occupied homes, and where do we make sure that families have access to resources, that if there is lead poisoning or lead exposure in their homes, where can they get the resources to do that lead abatement? Lead abatement can be a pretty expensive process, anywhere from $15,000 to $25,000 depending on the depth of the problem. So one of the goals that we have through this process is also to work together, as Commissioner Bolger said. Are there ways that we can advocate together at the state level and the federal level to make sure that there's additional resources available for abatement?
And I just want to add on those 427 homes, I hope that that is the battle cry for all of us. Those aren't just 427 homes that were identified as toxic. Those are 427 homes that are repeat offenders. So that means multiple families have come in and that home has poisoned multiple times. And so that's what really was the impetus for me to partner with Mayor Bliss, because that is completely outrageous and absolutely unacceptable in Kent County. So.
And we recognize that once those 427 homes are inspected or addressed, that's not really the end, because
Right.
there are going to be more homes entering the back of that line all the time as we do more testing. So one of the things we want to work on in this lead action team is how do we create a strata of prioritized homes, so that as we and after we address this most critical listing, what other high risk group of homes do we need to make sure that we're addressing?
And I'll add one more thing that we didn't touch on in depth, but this past year the county and the city partnered together around an awareness campaign, an education campaign. It was brief, so it was over a 6-month period. We know that that's not enough. We need ongoing, regular awareness and education throughout the entire county, so that families do know what questions to ask when they go to see their primary care physician. They know what to do if they're concerned about lead exposure. So we know that will continue to be something that we partner on, both at the city and the county level.
And I just want to add one more thing to that too. It struck me when I was talking to a young mother that, I grew up in the 70s and 80s, and, lead was still kind of an issue, because that's when we figured it out, right? So you just knew that lead paint was bad, but you have a whole generation of young parents who we initially did such a good job of getting lead awareness back in, probably the late 80s, early 90s, that you have a whole generation of parents that really don't even know about, and they're going into these homes and they're remodeling and they're taking out windows and they're chipping paint, and they have no idea about the dangers to this. So we have to educate a whole generation of new parents, really. Any other questions?
What sort of compliance or punitive measures can the county or the city take against any of these repeat offenders if they choose not to abate their homes?
So that does fall under the county prosecutor and not under city jurisdiction. So I'll let either.
Sure. And so, enforcement is always the last course of action that we want to take. Through inspection and through our observation of kids being harmed, if we determine that a residence is a public health hazard, then we can work to prohibit that being offered for rent or being occupied at all if it is that significantly dangerous to the community. So again, those are things that we want to not use as the first tool, but we need to recognize that those are things that we have as an authority that we will use if we have to, because we take this seriously and because kids are being harmed.
Thank you.
Thank you, everyone.
For coming.
Thank you.
It's been good work.